Can I take Tirzepatide and berberine at the same time safely? Tirzepatide and berberine can be taken together as no official contraindication exists, but speak with your doctor since formal interaction studies are lacking and medical supervision is essential. So can you take Tirzepatide and berberine together? It's a question we hear a lot, especially from people looking to optimize their metabolic health. Here's the short answer. There's no official contraindication that says you can't combine them, but there's also no formal research studying this specific combination. That means if you're considering it, medical supervision isn't optional, it's essential. Let's start with what these two actually are. Tirzepatide is an FDA-approved medication. You might know it as Mounjaro for type 2 diabetes or Zepbound for weight management. It's a once-weekly injection that works as a dual GIP and GLP-1 receptor agonist. That means it helps your body release insulin when your blood sugar rises, reduces inappropriate glucagon release, slows how quickly your stomach empties, and reduces appetite through pathways in your brain. Berberine is different. It's a dietary supplement, not an FDA-approved medication for diabetes or weight management. Research suggests it may lower blood glucose by activating something called AMPK and improving insulin sensitivity, but as a supplement, it doesn't go through the same rigorous approval process as prescription medication. So what happens if you combine them? The main concern is that both can lower blood sugar when you stack them together, especially if you're also taking insulin or sulfonylureas. Your risk of hypoglycemia goes up. That's something you need to monitor carefully with your healthcare provider. The other issue is gastrointestinal side effects. Both tirzepatide and berberine can cause nausea and diarrhea. Combining them might make these symptoms worse or more frequent. Here's something else to know. Tirzepatide slows gastric emptying, which can affect how your body absorbs oral medications, including oral contraceptives. If you're taking birth control pills or any other oral medications, talk to your healthcare provider about timing and whether you need backup contraception, especially when starting or adjusting doses. And if you're pregnant, planning to become pregnant, or could become pregnant, this is critical. Tirzepatide may cause fetal harm. You need to discuss this with your healthcare provider before using it. Here's the challenge. No clinical trials have specifically studied tirzepatide and berberine together. We don't have data showing whether this combination is more effective or what the actual risk profile looks like in real-world use. That's why this isn't a decision you should make on your own. If you're thinking about adding berberine to your tirzepatide regimen or vice versa, here's what to discuss with your doctor. First, tell them about every supplement and medication you're taking. Your healthcare provider needs the full picture to assess potential interactions and risks. Second, talk about enhanced glucose monitoring. If you do combine these, you'll likely need to check your blood sugar more frequently, especially when you're starting out. Third, if you're on insulin, sulfonylureas, or other diabetes medications, the combination might require adjustments as prescribed by your doctor to prevent hypoglycemia. And fourth, have a plan for managing side effects. Know what symptoms to watch for and when to reach out. Speaking of when to reach out, contact your doctor if you experience symptoms of low blood sugar like shakiness, confusion, sweating, or rapid heartbeat. Severe or persistent gastrointestinal symptoms like ongoing nausea, vomiting, or diarrhea also warrant a call. And if you have any unusual symptoms you can't explain, don't wait. It's also important to know that tirzepatide carries a boxed warning for thyroid C-cell tumors. It's contraindicated if you have a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2. Make sure your doctor knows your full medical history before starting. Let's recap the key points. Tirzepatide and berberine can technically be taken together since there's no official contraindication, but there's no research on this specific combination, so medical supervision is absolutely necessary. The main risks are increased chance of low blood sugar and worsening gastrointestinal side effects, and never start this combination without talking to your healthcare provider first. Bottom line, this is a conversation to have with your doctor, not a decision to make on your own. What's your experience been with combining medications and supplements? Drop a comment below. And if you found this helpful, hit that like button and subscribe for more evidence-based health information from Fella Health.